Okay, so now we're going to talk about arthritis. Okay, arthritis is a very general term and it means an inflammation of a joint. Arth is a joint in Latin and itis is inflammation. And it doesn't have to be debilitating as most people think. And we'll talk about the different types of arthritis and common types of arthritis and what we can treat, because chiropractic helps to relieve the pain of arthritis. It's not going to cure arthritis, but it's going to help to relieve the symptoms that go along with it. So as I said, arthritis is a very general term, which means inflammation of a joint. And inflammation is one of the body's natural reactions to any type of injury or stress, and it includes swelling, pain, and stiffness. Now what the inflammation does, or the inflammatory reaction does, it's part of the immune system reaction to, like I said, a stress or an injury. So what happens is the body increases the blood flow to the area. Okay, by increasing the blood flow to the area, what does that do? It brings in immune system cells, such as lymphocytes, macrophages, microphages, which help to clean up the area, get rid of a lot of the debris, the dead cells, and the toxins that are in the joint, helps to get rid of it. And then, by bringing in red blood cells, it's bringing in more nutrients, oxygen, which is very important in the inflammatory or anti-inflammatory process, and that helps to relieve the inflammation and return the joint to somewhat normalcy. Arthritis is when where a joint, I should say, is where two or more bones come together, such as the hip or the knee, or in the wrist, the carpal bones, or in the fingers, the phalanges, or in your ball and socket joints, in your shoulder, or in your hip, where they come together and the joint is covered with a smooth, spongy material called cartilage that I'm sure you've heard of in the past. And the cartilage helps to cushion the bones and allow the joints to move smoothly and without pain. The joint is lined by a thin film of tissue called the synovium, and the synovium produces synovial fluid, which is like a WD-40 for the joints. It helps lubricate them. The synovial lining produces the slippery fluid, as I said. Strong bands of tissue called ligaments connect the bones and help keep the joints stable. Muscles and tendons also help to support the joints as well. There are about 100 different types of arthritis, but the most common, osteoarthritis, rheumatoid arthritis, and gout. That's usually what most doctors see in their offices on a daily basis. Osteoarthritis is the most common and occurs when cartilage wears away. Now, why does cartilage wear away? Mainly as a result of stress, of pressure to a joint. Now, why would there be stress to a joint? Whether it has to do with obesity, the excessive amount of weight that's placed on these joints. The joints can't handle it and they eventually break down, especially when a person is 300, 400 pounds or so. They usually have joint problems. It's very rare to see someone that size without joint problems. The stresses of daily life, whether it's sitting for extended periods of time or carpentry, certain occupations, working out on the streets, the highways, puts a lot of stress on various joints in the body. The back, the spine is always under a great deal of stress, especially when we're doing a lot of lifting and bending. Plus the fact that we do a lot of things as a society, we do things improperly, and that will put a lot of stress to the joints, and the cartilage in the joints start to wear away, and that's called an osteoarthritis or osteoarthrosis, meaning degeneration. Right? And it mostly affects the hands and the weight-bearing joints of the body. Without the cartilage present to protect the bones, then they rub against each other. When you have a person who has bone on bone, like in the knee or in the hips, which are the most common besides the spine, then we're usually talking about a hip or a knee replacement. Okay, where they replace the whole joint with titanium because of the fact that it's bone on bone, the nerves are irritated, there's too much inflammation, and therefore there's nothing that can be done, including chiropractic, to really help to resolve the issue. Rheumatoid arthritis, long-standing disease that affects all the joints, but most commonly the hands, the wrists, and the knees. The peripheral joints that are affected more with rheumatoid arthritis. And rheumatoid arthritis basically travels through the blood. Okay, it's an autoimmune disorder that causes inflammation in the linings of the joints, And it's caused by the fact that the body, autoimmune, meaning the body doesn't recognize its own tissues. So therefore it starts to destroy those tissues as if it was foreign to the body. And when that happens, it results in a lot of inflammation. It will result in disfigurement of the joint. As you can see, here's a normal hand, and in this case now, you have deviation of the fingers. Gout is caused by inflammation of the joints as well, but it's characterized by uric acid crystals. Uric acid is the byproduct, the breakdown of certain foods such as proteins, and therefore when you have a high protein diet or you eat a lot of liver, it can cause uric acid to build up in the joints. When uric acid builds up in the joints, the immune system of the body reacts to the uric acid and it causes inflammation. And that's what gout is all about. It's an intense joint inflammation that occurs as white blood cells engulf the uric acid crystals, as you can see in the middle joints and the fingers over here. And it causes pain, redness, heat. Heat is as a result of the inflammation. So it occurs when your body produces extra acid or does not eliminate enough, or if you eat too many foods with purines. You're more likely to get gout if you're a man, if you have a family history of gout, or you drink an excessive amount of alcohol. Okay, that will also result in the uric acid crystals. So as far as treatment is concerned, treatment is really geared towards reducing the inflammation and mobilizing the joints because the joints are very stiff and fixated. Here is a picture we call subluxation degeneration. This is the neck, the mid-back, and the lower back. This is a normal neck, mid, and lower back. Then what happens is in phase 1, 2, and 3, as you move to the right here, you start getting more and more degeneration of the joints, specifically the discs, and what's known as the facet joints, which are the little joints between the bones, between the vertebrae in here. So you start getting a lot of degeneration in here. As you can see here, there's a narrowing of the disc. You can see it down here. Look at the wide spaces over here, but then you see how these discs are becoming white and very narrow. That whiteness has to do with bone erosion and the body reacting to the erosion until finally the bones actually start fusing together. This is a tough case. Once the bones are fused, there's not that much that anyone could do except for medication just to hopefully relieve some of the pain, but it's a temporary type of treatment. Whereas what we're trying to do is we would rather get to a person in a phase 1 or in a phase 2 and try to halt it in that phase. In other words, take stress away from the joints by mobilizing the joints, putting the bones back into place, and by putting them back into place you're relieving the stress on the joints, and therefore it helps to minimize the chances of those joints getting worse as time goes on. So we not only can relieve the symptoms or help to relieve the symptoms, but we can also play a role in the prevention of the degeneration or the degenerative process. And that's what chiropractic adjustments do. We realign the bones, making up the affected joints, being at the spine, the hip, the shoulder, knee, or the hand. So that's a brief overview of arthritis, and thank you for listening, and we'll see you next time.